Good morning, everyone. Good morning. Let's have a round. Good morning. Great. Well, I am so pleased to welcome you all to 2022 NAM annual meeting. I've been saying this all weekend. It's wonderful to see so many smiling faces back here now in the auditorium for our first in-person annual meeting in 3 years. And for those joining us online, welcome back, or welcome, and thank you for tuning in. Wasn't last night wonderful? I'm amazed that all of you are still standing, or at least you're sitting, and at this meeting. But we were truly energized. So it's just a wonderful thing back of the 50 years of our history. And of course, today you're going to hear about the next 50 years, as if we can predict, but certainly we will look at where we are now, where we need to be in the future. So we have an outstanding scientific program planned today that will focus on revolutionizing the biomedical and health sciences. You will hear from many notable speakers, including our keynote, Dr. Mariana Mazzucato, in just a while. So please be sure to stick around for the final session of the day, which I will moderate, called the Presence Forum. And the topic is Transforming the Future, Perspectives from Scientific and Institutional Leaders, that forum will convene diverse perspectives to examine how institutions, ranging from philanthropy, federal agencies, government to university and science publication, how it should transform and address the challenges and opportunities that lie ahead for our biomedical enterprise. But first, I'd like to begin this morning with some important Academy introductions and announcements. Every year at our annual meeting, we take the opportunity to introduce the class of NAM members who were elected last year, that is 2021, as well as our current fellows and scholars. So it's a great pleasure to welcome such an impressive group of individuals whom I have gotten to know better over the last few days. So let me begin by introducing you to the members of the NAM elected in 2021, who formally inducted this past Friday. And you would agree we have elected a phenomenal class of distinguished individuals. Very proud of this 2021 class, not only for its excellence, but also for its diversity in gender, race, ethnicity, and disciplines. Following their introduction, the new members of the NAM fellows and scholars will be introduced. So I ask all of you to hold your applause until all the names are read. We're going to do it by video, so please show the video.
Samuel Achilefu, Alexandra K. Adams, Richard M. K. Adenu, Michelle A. Albert, Guillermo A. Amir, Jamie D. Ard, John M. Balbus, Carolina Barrias Murray, Shari Barkin, Monica M. Bertagnoli, Luciana L. Borio, Eric Broat, Kendall M. Campbell, Pablo A. Selnick, David E. Clapham, Mandy K. Cohen, Hillary O. Critchley, Daniel E. Dawes, Ted M. Dawson, Job Decker, Nancy Ann M. DePaul, Maximilian Dean, Catherine Drassa, Catherine A. Fitzgerald, Yuman Fong, Howard Frumpkin, Andreas J. Garcia, Jennifer L. Gardy, Darrell J. Gaskin, Wunderson Ghebreyesus, Tedros A. Ghebreyesus, Jessica M. Gill, Paul B. Ginsberg, Sharita H. Golden, Joseph P. Gone, Colonel Retired John D. Grabenstein, Trish Greenhalgh, Linda G. Griffith, Tekji Ha, William C. Hahn, Helena Hansen, Mary E. Hatton, Mary T. Hahn, Zhigong Ha, Edith Hurd, Hugh C. Hemmings Jr., Renee Henn, Helen E. Heslop, Renee Y. Shaw, Lori L. Issam, Catherine U. Jansen, Christine K. Johnson, Mariana J. Kaplan, Elisa Kanafagu, J. Lemery, Joan L. Luby, Kenneth D. Mandel, Jennifer J. Manley, Elizabeth M. McNally, Nancy Messonnier, Mashidiso Moeti, Michelle Monje, Vamsi K. Mutha, Lenart Mookie, Vivek Murthy, Jane W. Newberger, Keith C. Norris, Marcella Nunez Smith, Osagi Obasagi, Wando Olaiola, Bruce Oviagele, Drew Pardo, Guillermo Prado, Carla M. Pugh, Charles M. Rice III, Marilyn D. Ritchie, John Arne Rottingen, Yvette Rubidoux, Eric J. Rubin, Renee N. Salas, Thomas Sequist, Kasoli Simon, Melissa A. Simon, Anil K. Sood, Samba O. So, Risa A. Sperling, Sarah L. Zanton, Sarah A. Tishkoff, Peter Tontanose, Joanne Trio, Gustavo Tereque, Gilbert R. Upchurch Jr., Tanir G. Vanima, Leslie B. Vosshall, Rochelle P. Walensky, Elizabeth Winsler, Cynthia Wahlberger, Anita K. M. Zaddy, Shannon N. Zink, Fang Zhang, the Robert Wood Johnson Foundation Health Policy Fellows 2022 to 2023. The NAM, AAN, ANA, ANF Distinguished Nurse Scholar in Residence 2022 to 2023. The NAM Fellows 2022 to 2024. The NAM Scholars in Diagnostic Excellence 2022 to 2023. The Emerging Leaders in Health and Medicine Scholars 2022 to 2025. Congratulations.
So will all the new members, fellows, emerging leaders who are here today, please stand. We're going to give you another round of applause. I hope you feel very welcomed. You know, our members and fellows are a truly remarkable group of leaders who are committed to improving health and making the world a better place for everyone. We rely on them to share their experience, their expertise, and guide the work that the NAM and the National Academies do. Without our members, the NAM could not have made such an impact over the last 50 years as we have discussed yesterday. Now, unfortunately, we have lost several of our colleagues and fellow members since our last meeting. You'll see all their names listed here on the screen. Please stand and pause for a moment of silence to acknowledge them and pay our respect to them. Thank you. I'd like to pay special tribute to Paul Farmer, my colleague and a dear friend for nearly 30 years, who passed away unexpectedly in February this year. His passion to serve the poor and under-resourced remind me of my roots and continues to inspire me every day in my work and life. Paul set an important and enduring example for the health community. We must reach out to help those who need it, no matter the scale of the challenge. He was a human being who saw humanity in others. His spirit of service was a rare gift to this world, and he'll be truly missed. Now, turning to our awards. Yesterday, we recognized 3 individuals in the fields of health, medicine, and science. Mary Naylor from the University of Pennsylvania School of Nursing. She was the recipient of the 2022 Gustav O. Linhart Award for Advancement of Health Care, and she receives honor in recognition of her work to improve lives of millions of older adults living with complex health and social needs through her role as the architect of the transitional care model and pioneer the field of transitional care. So join me again in congratulating Dr. Naylor. Next is Daniel Gershwin from the University of California, Los Angeles, recipient of the Rhoda and Bernard Sarnat International Prize in Mental Health for his groundbreaking work and leadership in the area of autism genetics. His creation of Autism Genetic Resource Exchange demonstrated the power of community resources to expand these important research efforts. Join me in congratulating Dr. Gershwin. And Jeffrey I. Gordon from the Washington University School of Medicine. He was the inaugural recipient of the 2022 David and Beatrice Hemberg Award for advances in biomedical research and clinical medicine. This award was given, now for the first time, to him for discoveries that transformed the understanding of how human physiology is shaped by microbial communities. Dr. Gordon made remarkable discovery on gastrointestinal development and the human gut microbiome, and translating those breakthroughs into actionable interventions to reduce global health inequities. So please join me in congratulating Dr. Gordon. This weekend, we also present awards to NAM members whose service to the mission of NAM and the national academies have been particularly distinguished. Michael Johns was awarded the Walsh McDermott Medal. Dean Jameson was awarded the Adam Yamolinsky Medal, and Dick Jackson was awarded the David Rao Medal. Please join me in a round of applause for them. We also presented the CISO Awards to staff throughout the National Academies whose service have significantly contributed to progress towards our mission. We recognize Jamal Samuel, Sarah Beachy, and the Primary Care Consensus Committee staff team. Please join me also in a round of applause for those individuals. So congratulations again to all our deserving award recipients. So now I am delighted to have the opportunity to deliver my annual report as the president of the NAM. First, I'm so pleased that we are able to gather in person to celebrate the 50th anniversary of the NAM. Of course, we should have celebrated this in 2020, but unfortunately, COVID-19 pandemic had other plans. So we're actually 52, but who's counting? So the pandemic has been such a global tragedy, and it's far from over, with new variants continuing to emerge around the world. But at the same time, COVID-19 has also served as a poignant reminder of our relevance more than 50 years since the founding of the IOM and now the NAM. Health and medicine have been at the forefront of so many society's biggest challenges, including this one. And I'm proud that NAM and the National Academies were able to pivot quickly so we can deliver rapid, expert, real-time advice in a time of crisis. But this couldn't have happened overnight. We're fortunate to have a strong 5-decade foundation on which to build. As we help the nation and the world respond to the pandemic, the NAM and the National Academies have played a major role advancing some of the health and medicine's greatest achievements, including launching the global patient safety and quality movement, sounding the alarm on HIV/AIDS epidemic, proposing mapping and sequencing of the human genome, improving cancer and mental health care, steering progress on the future of nursing and primary care, and so many others. We've accomplished a lot of great things over these 5 decades, and we should rightly celebrate. But as the past few years have shown us, we certainly have no time to rest on our laurels. Our work is more important than ever. I've spoken about triple existential threats that we face, and they show in this slide: COVID-19 and the possibility of future epidemic and pandemics, climate change, which is already affecting health of millions, systemic racism, racial economic inequality, which are still preventing far too many from reaching their full potential for optimal health and well-being. And of course, the continued rise and weaponization of mis- and disinformation have impeded progress on all of these fronts, eroding public trust in our institutions, in scientific research, and in the knowledge and expertise of a scientific community. Russia's unprovoked war on Ukraine has triggered a major humanitarian and health crisis, and there's no sign of ending anytime soon. Here in the U.S., familiar and long-standing problems continue to plague us. We've seen far too much gun violence over the last year, including tragic mass shootings like those in Uvalde, Buffalo, and most recently in my hometown, Raleigh, North Carolina, as well as thousands, tens of thousands of other firearm-related murders and suicides. The Supreme Court decision to overturn Roe v. Wade will potentially worsen women's health and increase inequalities in maternal and reproductive health care, especially for people of color. And this at a time when the United States already has one of the highest maternity deaths of any developed nation. You know, these are grim realities that we face now, and we certainly will encounter other major challenges and disasters in the years ahead. So if the last 50 years is any indication, we should also know that science and medicine can and will provide solutions. Looking back, our parents, grandparents never could have imagined the explosion of new knowledge, tools, treatments, and technologies that we have today. As a cardiologist, I'm awestruck by our progress in treating heart disease. You know, 50 years ago, we had very limited treatment for myocardial ischemia, arrhythmia, heart failure. Today, thanks to multiple drugs and new technologies, heart disease death rates have declined by almost 2/3 and stroke by more than 3/4. Since the 1960s, we are preventing some 1.5 million deaths each year because of these innovations. Our ability to treat many types of cancer is yet another modern miracle. We now have 14 million cancer survivors here in the United States, which had been unthinkable even 30 years ago. Rather than being a death sentence, more than 2 in 3 people diagnosed with cancer will live at least 5 years, and many will live well beyond that. And we're poised to do even better. We can now identify molecular features of specific cancers and tailor targeted therapy to individual patients, and through immunotherapy, we can harness the immune system to successfully fight cancer. Similarly, HIV/AIDS was once a death sentence, and now with widely available antiretroviral therapies, coupled with tremendous shifts in knowledge of how to treat at-risk populations, we have transformed the prognosis. HIV now can be managed as a chronic disease, and we can reduce dramatically the risk of transmission. You know, these amazing achievements were considered stuff of science fiction to previous generations. I'm reminded of Aldous Huxley's 1932 novel, The Brave New World, describing a future dystopian society with genetically modified citizens and intellectual-based social hierarchy. You know, today, many of the technology that Huxley predicted, including genome editing, artificial intelligence, brain-computer interface, are no longer limited to one's imaginations. So we have to do right. Unlike Huxley's dark worldview, we can apply these technologies for the good. And we can also anticipate potential concerns and consequences and really work hard to mitigate them. So it's so exciting to imagine where science and technology will bring us in another 50 years. New developments in genomics, nanotechnology, engineering, other fields are sparking radical innovations. Gene editing technology could allow us to prevent or cure Huntington's disorder, cystic fibrosis, sickle cell disease, and other devastating illnesses. What's more, researchers are developing single-shot gene therapies that could make these treatments more available and affordable to patients from all countries and backgrounds. Big data and artificial intelligence have the potential to significantly improve productivity, efficiency of care, and reduce medical errors. In biomedical research, AI can identify new applications for existing drugs, transform the way we pre-screen patients for disease, reducing the need for highly invasive and intensive treatments. Cancer Quebec Initiative has set an audacious goal, and I see this in quote, to cure, prevent, or manage all diseases by the end of this century. In other words, 80 years from now, or less than 80 years. Well, some researchers believe we can really do this because we humans could one day be made immune to all viruses. Won't that be nice? And the effects of aging could not just be prevented, but reversed entirely. There is a lot of research going this way. Now, these may sound like a fantasy, but when we consider how rapidly science and technology are advancing, so much is possible. Just think 80 years ago. Penicillin was relatively new. We had no vaccines for polio, measles, rubella, and we have no effective drugs to treat many conditions, hypertension, heart failure. So I want us to remember the old adage. Most people overestimate what we can achieve in a year, but underestimate what we can achieve in 10 years. So the question we have to ask ourselves today is, what will we make possible in the next 50 years? Well, I can tell you we can't predict everything that will happen in the future, but we can do something far more important. We can help build this. In fact, as scientists and health professionals, and together as the NAM, the actions we take now and decisions we make every day are determining the future for ourselves, our children, grandchildren, and great-grandchildren. So the question is, how can we keep making incredible new advances in science technology while also ensuring that these advances benefit all of society? If we learn anything, especially the last few years, it's this. Science and technology offer solutions, but they're only tools. How they're used, who have access to them, how they're communicated, accepted, and adapted by society are just as important to their success as the efficacy of the tools themselves. So in the midst of our desire to innovate, we must communicate clearly about the benefits of science and medicine and earn the public's trust through our words and deeds. You know, as a nation, we're spending 20% and probably more of our GDP on healthcare, and yet many Americans face major barriers to accessing even basic care. And sadly, over the last 2 years, our life expectancy has fallen dramatically. Americans are now living 3 years less on the average than 2019. I think this is unacceptable. And as always, some groups are more affected than others. Native American and Alaska Natives now have an average life expectancy of just 65 years, equivalent to the average American life expectancy in 1944. Now, this overall drop in life expectancy in the U.S. is not just due to pandemic. We're seeing more deaths from chronic disease and, of great concern, drug overdose, alcoholism, liver disease, which Angus Deaton and NK's term is deaths of despair. Long-standing problems of poverty, discrimination, racism, access to care are continuing and have even gotten worse in some cases. But it doesn't have to be this way. Our health system, in many ways, is one of the best in the world, but is fragmented and inequitable. We prioritize treatment over prevention and fail to address the root causes of diseases such as social inequity, poverty, and environmental justice. So science and technology are constantly progressing, but also our medical education, health education training system is falling behind. Our healthcare providers also have been pushed to the brink, as you know, by the impact of COVID-19, and even before then, through stress, distress, burnout. And of course, data science and AI and other innovation could potentially provide benefit for those patients and providers, but only if we are prepared to take advantage of them in an equitable and just manner. So how can the NAM, all of us, be ready to help to build the future we all want? Our mission: to improve health for all by advancing science, accelerating health equity, and providing independent, authoritative, and trusted advice nationally and globally is more important than ever. But to fulfill that mission and meet the many current and future challenges, we need bold thinking, creativity, a radical shift in the way we operate. Over the next 50 years, I envision an even more dynamic NAM, one that proactively prepares society to anticipate, to adapt to, and respond to future challenges and opportunities. And in order to inform decisions built on a better world, NAM will need to commit to a culture of continuous learning and innovation, enhance our capabilities and innovate through strategic deployment of cutting-edge tools, systems, and technology. Build deep and diverse networks of partners, and importantly, we must commit to prioritizing diversity, equity, inclusion in all that we do. Let me be clear. Our principles and values will never change. We'll always be unwavering in our commitment to scientific excellence, integrity, and rigor. We must remain steadfast to our objectivity and independence and to catalyze action for the greater good. We will always be a science-based organization, and as science rapidly evolves, we too must lead changes in scientific enterprise. During today's meeting, which is focused on revolutionizing the biomedical and health sciences, we'll explore in depth how to transform our research enterprise to meet future challenges and best help humanity. We'll take a deep dive into what kinds of disruptive technology strategies we need in governance models, education, training, funding mechanisms, scholarly publication, and public-private partnership. And then these issues will be discussed in depth in today's meeting, and I look forward to an exciting discussion. So, indeed, first, our academy was committed to continuous learning and innovation. Embracing a more dynamic future requires calculated risk and actively inviting improvement. NAM has long advocated for health communities to harness knowledge to drive innovation. We need to follow our own advice. Well, we saw many examples of accelerated innovation during the pandemic. For example, the National Academy Standing Committee on Emerging Infectious Disease and 21st Century Health Threats developed a new and novel mechanism known as rapid expert consultations to provide near real-time, peer-reviewed, evidence-based advice in a matter of weeks to policymakers and the public. Now we're trying to improve on this successful model so we can respond more rapidly to fast-moving events. Of course, these approaches were at times met with skepticism, but we know that it's crucial to foster a culture where we're not afraid to try new things, even if we risk failure. As scientists, we understand that failure is an inescapable part of research. You know, the astrophysicist Erica Hamden said, discovery is mostly a process of finding things that don't work. Don't we all know that? And failure is inevitable when you're pushing the limits of our knowledge. The next point I want to make is that we need to become even more proactive, more anticipatory, and more visionary for the future. Modern science has made momentous achievement in understanding the world as it is, but the NAM must begin to consider the world as it will be. That means not only investigating problems of today, but also imagining the problems of tomorrow, and so many tomorrows to come. So how can NAM set the future agenda for science and healthcare? Well, we can predict, address problems before they have a major negative impact. So to become more anticipatory, we must harvest ideas from sources across the globe and use cutting-edge research as specimen methodologies like horizon scanning, predictive analytics, trend for forecasting, because these methods will allow us to identify early signals of potential change, predict certain situations or events, and leverage data mining technology to judge what we might expect to see in the future. Let's take pandemics. COVID-19 is an example. Despite previous warning, the world was not prepared. In the future, it must be our goal to initiate and lead conversations and not merely to contribute to them. We must proactively identify emerging problems and opportunities and apply advanced forecasting methodologies to prepare for the possible and probable events. Indeed, NAM should prepare the nation or the world on how best respond to many political, economic, and healthcare possibilities. This type of strategic thinking will allow us to be more flexible, nimble, and dynamic in a world that's constantly changing. These innovative approaches are dependent on data, and so NAM must embrace increasingly large data sets, utilize tools such as artificial intelligence, machine learning, and link data from multiple sources, including healthcare data, population community-level data, wide range of health-related data. To support our vision of a more proactive, forwardly thinking organization, we need to advance our capabilities, redesign our workflows, support new deliverables, and respond to areas of need more quickly than ever. To truly transform, we must use and implement state-of-the-art technology, planning tools, and methodologies. However, our people will always be the backbone of the organization. They are and will always be the reason for quality excellence of our work, and they embody our principles and values. We need to build them into a future-ready workforce. We need our people to be adept at continuous learning new skills and capabilities. We must consider how and where we work best and explore new methods and models that are unlike those we employ now. Just think about what COVID's done and how much now flexibility virtual working it is for all our staff, for all of us. 50 years from now or sooner, the NAM's workforce and workplace will look very different than now. For example, I can imagine a future when our committees, like you, use data science combined with AI to quickly search large databases, combining evidence and synthesizing research to address a huge range of complex issues. We could invest in new technologies to strengthen budgeting, forecasting, improve management of projects and workflow, and facilitate collaboration and enhance the stewardship of our members and volunteer relationship. We must leverage technology to develop living reports that could be updated, reviewed, and published in real time. You know, AI is even moving us closer to the possibility of a hybrid human-automated workforce, ideally improving both effectiveness and efficiency. We must begin preparing now to ensure that we build a confident workforce that's well-versed in new technology and to create bold new approaches. So to be more proactive, we have to engage stakeholders on the ground and form radical partnership with a much wider, more diverse range of partners in healthcare and beyond the healthcare sphere. We must find ways to communicate, engage with partners and with researchers, opinion leaders, sponsors, private sector, and global institutions. Without broad, diverse engagement, we miss the opportunity to acquire new knowledge, to identify sources of support or potential pain points, to communicate clearly, and to ensure our deliverables meet the needs of the community that they will impact. For example, today, through our initiative on emerging science, technology, and innovation, in addition to scientists and innovators, we're working with actually private industry and venture capital investment communities because they're the key stakeholders in addressing emerging technology and the societal applications. Similarly, in our grand challenge in climate change and human health equity is harnessing innovative collaborative partnership with multiple public-private sectors outside the health to address this existential threat. In the global arena, we ramped up our partnership and collaboration with G20, G7, the WHO, World Bank, and multilateral global agencies. And we need much deeper engagement at the city, state, and community levels. We must strive to bring in more voices, communities, and lived experience into our work. We must pursue not just multidisciplinary efforts, but true convergence across fields to address complex areas of needs. And of course, we'll always strive to preserve our independence, objectivity, avoid conflicts of interest, and to solve complex problems that society face. But we must absolutely draw upon expertise of all partners, public and private, and internationally, regionally, and locally. On top of this, we must develop a communication strategy for the future. Advising and convening stakeholders is not enough. We must ensure that we are considering our entire audience and how we can best reach them. This includes our members, the general public, policymakers, decision makers nationally and globally. You know, 50 years ago, well, maybe 20 years ago, 15 years ago, social media did not exist. And the world of communication looks so different. So now we need to use all available tools in the future, especially when we consider the emerging and continuous evolution of social media. Given the world that we live in today and the rise of misinformation, we know this will require a deep understanding of behavior as well as understanding of new ways to communicate and how best to reach different members of our audience. We have a lot of work to do. Above all, we must maintain and grow a deep commitment to diversity, equity, inclusion in all that we do. This commitment is rooted in our program, work, staff, membership, and leadership. We're truly committed to this. First, we must ensure that NAM staff and members represent the diversity of our population and a broad array of demographic factors. These are individuals are at the heart of what we do, and we should ensure that they are offered the opportunity to speak to their strengths. We need to create an inclusive, welcoming culture for our members and staff and everyone. I'm really proud that our concerted efforts, led by so many of you, to increase diversity of membership are paying off. Last year, from record number of more than 1,000 nominations, we elected 100 new members. But the most diverse class to date, more than half are women and 50% are underrepresented minorities. This year, the newly elected class also very diverse, and we have announced the new members, 50% women and 49% underrepresented minorities. This newly elected class also includes 8 members from underrepresented states, a record number. And we're very excited that we elected 3 Native American members last year and 3 this year, bringing total number of Native American members to 7, because there's a lot more work to be done, but it's a good step in the right direction. So as we move toward becoming more of a service institution, more than an honorific society, we must find ways to engage and our members ensure our expertise reflect the challenges that we face across society. To that end, our member election process has really evolved over time and developed mechanisms to ensure the inclusion of younger members, those from underrepresented backgrounds. And we have instituted special emphasis to elect members whose expertise are key to meeting challenges of our time, such as climate, technology, and inequality. To be a future-oriented organization, NAM needs scientists, clinicians, and experts who are the future in the fields. We're cultivating the next generation of leaders through our Emerging Leaders Program and the fellowships that you met, many new fellows, and their entire portfolio. We deeply rely on wisdom of our more experienced members, but we also need these new voices and creative insights. Embracing diversity, equity, inclusion is more than just ensuring diverse representation of work. We must intentionally and thoughtfully build deep interactive relationships with diverse communities. And more broadly, NAM must prioritize health equity as the goal that underpins everything that we do. I've said in my writings and speeches that there can be no health equity without social equity. NAM programs must address root causes of inequities, systemic racism, economic instability, lack of community support, and difficulty in accessing education and healthcare. This is our vision for NAM's future. And in many ways, we are on our way, as we also develop a refresh of our strategic plan to roll out in 2023 or 2024, and we look forward to having many of you volunteer to join us in this work. Our consent study have long been considered a gold standard, providing definitive guidance and stands the test of time. But since science and evidence are moving really fast, and we must keep pace and innovate, we want to make relevant the contributions to our ever-changing world. Our institution should strengthen all of its components to achieve continued success and sustainability and resilience. So as we mark our 50th years in service to the nation and the world, we should be proud of how far we've come in health and medicine. and as a premier academy nationally and globally. We're heading in a bold new direction. We have so much to be excited about in terms of where science technology may take us, even as we face so many intersecting, fast-moving challenges, and with so much work ahead. We are dealing with several existential crises, and without a doubt, many others will surely come our way. But at this time, I reflect on everything we already accomplished, but I can't help but feel optimistic. I hope you do too. 50 years ago, few people would have predicted the devastating COVID-19 pandemic, or how quickly we developed safe and effective vaccines. 50 years ago, we won't have dreamed of being on the cusp of curing cancer, preventing heart disease, or eliminating devastating genetic diseases. So what will health medicine look like in year 2070? That answer is up to all of us. In the words of the great civil rights activist Ralph Abernathy, I don't know what the future may hold, but I do know who holds the future. We do, every one of us. By working together and using the tools that science and medicine provide, we must and we will create a healthier future for everyone. Thank you very much indeed. Thank you. So before we begin the scientific program, I'm pleased to tell you that the new elected class of 2020 has just been announced. So please visit nam.edu/class of 2022 to learn about this class. So next thing on our agenda is the scientific meeting, and it's my pleasure to kick off our scientific program for the day. For those who are just joining us in person online, welcome to the 52nd National Academy of Medicine annual meeting. Thank you, all of you, for attending. Every October, our annual meeting is the gathering of our distinguished members and the most important meeting of the year for the organization. Today's program, Revolutionizing Biomedical and Health Sciences, promised to be stimulating, and for this we must thank our program committee, including from the NAM Council Standing Committee for Program Planning, Jeff Balzo, who's the chair, and he'll be up here in a few minutes, Ken DeSalvo, Juanita Merchant, and Huda Zogby. And with the expert participation of other NAM members, Kathleen Hall Jameson, Bill Stett, Leslie Valshaw, and Keith Yamamoto, and the staff support from Jessica Marks. Please join me in recognizing the tremendous work